I'm in my hole.
Why don't I just die?
Yeah. Okay, I'm going to read a case study that was sent to me last night from a doctor friend of mine. This is real. This is one that's actually kind of ongoing. 96-year-old male non-Christian who was one of the first men to ever build airplanes. He lived very independently until the last 4 months when diabetes that became uncontrolled contributed to the loss of a left leg. He was extremely adamant that he would again be able to walk. Plans were made to give him a prosthesis. During hospitalization, he underwent his amputation and was found to have severe fluid on the lungs, high risk of aspirating every consistency of liquids and solids he put into the mouth. So in other words, this dude's choking anything that goes down. In addition, he became septic, meaning he had a major body infection, requiring a total of 2 weeks in the hospital, cost of $76,000. He refused to have a feeding tube, which became problematic because we couldn't get liquids or solids down his mouth. 3 weeks ago, he went into the hospital, again for a pulmonary embolus, which he got because of the Coumadin. His blood thinner was stopped in order to prepare his leg for amputation. The amputation was performed, and within 3 days, infection set in. Cost of this additional hospitalization has been $25,000. Here's your choices you need to make. You got 3 possibilities. Number 1, you can give him IV antibiotics for 10 days and then do the other above-knee amputation on the right leg with no hopes of him ever walking again, only for him to be bedridden with continued risk of recurrent hospitalization for aspiration pneumonia. Number 2, you can force this man to start a feeding tube, in which case he should be able to regain some strength. Number 3, you can put him in hospice and allow him to die. Let's start with, let's go all the way back to Mr. Quentin. What would be your course of action?
I do not know.
Okay. You would probably not make a good doctor or a counselor then, but let's say that you had to give this guy some counsel. What would you tell him to do?
Give me the brief summary one more time. I have a hard time paying attention.
Okay.
Get it all wrapped up in one point.
Old man, diabetic, has a loss of circulation in a leg. He's going to have it cut off. He wants prosthesis because he believes he can walk again. During the procedure, things go wrong. He starts basically choking on liquids and foods. They can't do everything they need to do, and they really need to put a food tube in. He says no go. He racks up $100,000 in hospital bills, and basically he still has one leg that needs to come off. He's never going to be able to walk again. He is adamant that he doesn't want that kind of life. So do you put him on antibiotics in hopes that you can kind of get him to a place where he can regain his strength? Do you force him to have a feeding tube, or do you put him in hospice?
I say, listen, sir, I'm going to be real with you. You need the feeding tube.
And he says, and he looks at you and says, you are young, you are healthy, you got a life ahead of you. I don't.
Do you believe in God?
He is a non-Christian male.
But just because you're non-Christian doesn't mean you don't believe in God.
And furthermore, Dr. Quentin, I think you're just trying to zap my savings so that my kids won't have any inheritance.
Listen, that's not what I'm trying to do. I could care less about your savings. I could care less about your money. But what I do...
So you'll do all this for free?
Excuse me?
So you'll do everything for free?
This one time I can do that for you. And listen, I care more about your soul than anything else. And you can be an inspiration to kids around the world. by showing them that you can get through struggles with God's help. So would you like to be baptized or not?
Very good, very good. All right, somebody else, what would you do? Dean?
Well, if he's adamant that he doesn't want the feeding tube, and if he doesn't want the antibiotics, I just put him in hospice care, and then just try and convert him from, taking care of him.
Okay, let's have a quick talk about this. Does his age matter in this scenario to you?
Oh, yeah. Sure does.
Okay. Does his disease state matter?
Sure.
Yep.
All right, what about his mental state?
Yes.
Yes.
Definitely.
Okay, if I reveal to you that giving this young man or this older man an antidepressant would change his entire outlook,
About
does that come into factor?
About what?
About his future.
Sure it does.
Okay? What about his rank in society? Does that matter?
Nope.
Yes.
Nope.
What do you mean by rank in society?
You got a 96-year-old man
Nope.
who is basically going to be bedridden.
No, it doesn't matter.
Okay? What if the family of physicians did not know his wishes?
That matters.
So let's say that this guy's unable to communicate to you.
Then how do we?
Does that change that? Do what now?
You can't,
And how do I know?
change the situations every time.
So he can't communicate. He communicated with me, but he can't communicate with anybody else.
No, let's just back it up and say that he is in this shape, he is bedridden, but he can't communicate, period.
So nobody knows what he wants.
Right.
Does that matter?
Ch-
Yeah. Sure it matters.
Chuck,
So he doesn't have a written will or
Nope.
anything like that?
which by the way, the vast majority, in fact, let me see a show of hands, how many of you guys actually have a will? There we go. Thank you very much.
Give him a written will?
Case in point. So he has no will. He has no advance directives, nothing like that.
Okay, so the next person closest to him would have to make that decision for him. It wouldn't be left up to the doctor, would it?
They don't have a next person. The only people with him are members of the church who happen to be this guy's neighbor. They don't know of any kids. Wife's obviously gone, dead. What do you do? I'll tell you, I'll go ahead and kind of give you the end story of that one, just because my buddy sent it to me. He said he chose hospice. His diabetic medications, antibiotics, blood thinners were all stopped. In the first few days of hospice, he held his own. Then he became unresponsive. His vitals were good. He was like this for 5 days, and then he died. He showed a great deal of concern about the $100,000 in the last 4 months of his life and did not see this as euthanasia. Let's change the scenario just a little bit. Let's say you've got a person who has got Lou Gehrig's disease. Everybody know what Lou Gehrig's disease is? Basically, it's where your body just starts shutting down. Usually you die of respiratory failure. You got somebody who knows they're sick, who is shutting down. They have expressed that they want to die of natural causes rather than have this disease be dragged on and on and on and on. And they are living in a state that allows assisted suicide. You are their preacher. They call you in, they say, hey, here's what I want to do. I want this doctor to prescribe to me an overdose of phenobarbital. What do you say?
No.
All right. What happens if they go against your wishes? You're there by their bedside. you realize that, and this is not a stretch, guys, I'm not making this one up. Let's say you realize they have gone past the point where they can successfully swallow very easily. They certainly cannot lift the phenobarbital to their mouth. And so either you or the doctor has to hold it, put it in a straw, and deliver it into their mouth and help them swallow.
No.
I would not do that.
The other doctor can do it, but I'm not.
What if you see the doctor do it?
Well,
The state laws allow it. I don't think that would really call the preacher into any kind of action.
They allow physician-assisted suicide, but they do not allow physician-appointed or physician-dictated suicide. In other words, if the physician actually does the doing, if he does the deed, you're busted. Because in all of physician-assisted suicide cases, basically what their only responsibility is to prescribe something that can be lethally, toxic or that can kill you. It's up to you as the person to make the conscious choice, do I want to take that? So, Michael Jackson. What do we do with this doctor? Is he guilty? If so, what's he guilty of?
assisted.
Killing Michael Jackson.
Yeah. Wouldn't it?
Okay.
No
So
worse than that.
Michael Jackson asked him to give him this drug, right?
Mm-hmm.
And legally, he had no reason to be prescribed that drug, correct?
Correct.
And the doctor.
Well, actually, no. The drug was a powerful painkiller.
Right.
Michael Jackson's saying, I'm hurting all the time, give me some.
Okay. Well,
He gives it
well, all kinds of people go down and say they're hurting, and
Absolutely.
that doesn't mean that a physician is it within a physician's legal purview just to go ahead and do whatever. I go down and say, I got a toothache. Could you give me some heroin? I mean,
That's well, we used to have people that would come into the ER, and one of the common phrases was, "Hey, I'm allergic to everything except allotted," meaning basically, I'm coming in here to get a drug. You got to remember, this physician's only job was Michael Jackson. So Michael Jackson is paying this guy big money to be with him 24 hours a day, 7 days a week. Now, if he is your only client and your only client says, I'm hurting, give me more drugs.
the money and the fact that he's your only client should have absolutely nothing to do with it. It has nothing to do with your Hippocratic Oath.
Okay?
The guy's going to jail.
He needs to be charged with manslaughter. Because I don't
With
know.
manslaughter.
I don't know if it was his intent to kill him. If it was, then obviously he needs to be tried for something more harsh. But if he was just negligent, it was something that was unintentional and an accidental overdose, even though it was stupid to begin with. He at least needs to
Okay,
be charged with something.
so you're saying that intent would have something to do with it?
I think intent does. I mean, but don't take that too far. Even if you destroy life, you're destroying life, and you need to be held accountable. But
Okay. All right.
if there's intent there, then there's a whole other.
There's been other doctors in this world that have prescribed something and people overdose that they don't get charged for, do they?
Because that doesn't mean they
Oh,
should.
yeah.
People do make
It
mistakes.
happens, it happens all the time.
People make mistakes.
We're going to talk some today about some of the common mistakes like that. Let's jump right into the lesson. Obviously, you guys know today we're talking about the value of life. We're talking about euthanasia, things like that. Let's start with this one. If someone knows that they're probably going to die by a particular act or a job, would you guys consider that suicide?
Yes.
Well, no. You can't equate those two examples. Like you're talking
Okay,
about.
so we got somebody who wants to jump the Grand Canyon, and you pretty much know that dude is pretty much gonna eat the dust. But he thinks it's...
Coast Guard. Yeah, those aren't equitable. The Coast Guard going into Arctic waters to save somebody is not the same thing as some yahoo jumping into the Grand Canyon on a motorcycle.
Well, even if the Coast Guard guy knows that roughly 73% are never coming out of the water.
Self-sacrifice and suicide are two different things.
Okay, what is the distinction there?
Intent.
Well, not just intent, but if you're sacrificing yourself for somebody else, I mean, Jesus didn't commit suicide.
Okay.
And
Let's
you step in
keep
front
going.
of a moving car and to save a child, and to push a child out of the way, knowing that you're going to lose your life in the process, you committed suicide.
Hey, Brad.
Yes, sir.
If that's the case, then anybody that dies in combat, have they committed suicide?
We're going to talk about that. Very good question, Mr. Dean.
I would say
Overall,
no.
suicide is the 8th leading cause of death for Americans, 3rd leading cause for death of young people. In fact, guys, get this. More teenagers, young adults die from suicide than cancer, heart disease, AIDS, birth defects, stroke, pneumonia, influenza, chronic lung disease, all combined.
Wow.
Now, having talked about that, somebody already kind of broached this just a little bit, but could we consider suicide and martyrdom ambiguous?
Intent?
No, we don't have, no.
Ambiguous.
Yeah.
Comparable?
I mean, are they basically the same thing?
No.
Nope.
Why not?
Intent.
And the presence of
One selfish,
an
one
innocent
unselfish.
individual who's being protected or who's
Martyrdom is a result of standing up for Christ, and that's what the early church went through. And in fact, in Revelation, they're told not to waver and to continue into death. So
Let's go back and learn a little bit of history, okay? Is it possible that the early Christians were so anxious for death that they willingly sought it?
it's possible.
There were some.
And by that I mean you're talking about a fairly new religion, and they witnessed the leader of their religion die on a cross, and so now they're thinking, hey, maybe this will be a good thing.
Yeah, that's possible.
Glanville Williams, he said this. He said, many Christians, therefore, committed suicide for fear of falling before temptation. Now, what does that mean?
that they succumb to a different temptation.
That you've got a group of people who are so wanting to be with Christ, be in heaven, that they don't want to sin. They know sin separates you from God, and so rather than live out their life to the natural end and risk sinning, they go ahead and end their life.
That makes no sense to me. And I don't think it made sense to the early Christians either.
Okay, why would you say it doesn't make sense? I'm not disagreeing with you at all, but I'm curious.
First off, the Christian, if you were a Christian, you were taught something. You weren't taught to do that. So you were taught a certain way. Martyrdom, when you look at Stephen, or someone like Stephen, he died because he was standing up. Standing up and dying is different from, just Christian teaching doesn't even teach that. And before you become a Christian, you have to know you are taught, and you're not taught that. Period.
So you think the Ethiopian eunuch knew that from that short little chariot ride?
For sure.
Wow. Okay. Let me ask the question, is there a difference between voluntary death and suicide?
Most definitely.
What is that?
Sacrifice.
What do you mean by voluntary death?
Voluntary death.
Depends on what your definition of is.
So, Dean, I hold a gun to your head. I say, you denounce Jesus Christ or I'm going to put a bullet in your head.
Nah, you're just going to have to pull the trigger, brother.
And that's
So that would be voluntary death.
That's not suicide.
Okay, what's the difference is what I'm asking.
Suicide would be like me coming... Suicide usually is... It has to do with... I believe it has to do with intent. Voluntary death, that's me standing up for what I believe is part of my religious background, where suicide, I think, it's not only an action, it's a state of mind where you feel there's no hope left. You feel that there's no purpose left for you in life. So you either kill yourself because you have no hope, or you ask somebody else to kill yourself. It'd be like me coming to you and saying, put that gun to my head and pull the trigger because I've got nothing left to live for, as opposed to you saying, hey, denounce Christ or I'm going to shoot you.
Right.
Those are two totally different situations.
Suicide is a negative act.
Well, and it's who's making the choice. I mean, who's initiating?
Getting there.
I'm saying who's responsible for initiating the situation. You see what I'm saying? In other words,
Absolutely.
because if there's an external voluntary death, Paul, the Apostle Paul, he talks to the Philippians about trying to, being hard pressed as to whether or not he wants to go ahead and, whether he wants to stick around or whether it'd be better if the Romans go ahead and kill him. He's not actively courting death. He's not trying to get killed.
Okay.
He didn't commit suicide, but he knew the things that he was saying and the things that he was doing were going to ultimately more than likely result in somebody lopping off his nugget. If I commit suicide, I've made the decision to end my own life.
Right.
I've created that situation. If I voluntarily die in a situation that somebody else has created as an act of as a sacrificial act, it's not the same thing.
Okay, you guys, I know Chuck and Quentin both have questions. Y'all hold on just a second. I'm going to read you 7 points that I want you to think about and consider. These are 7 points that if just a naive person off of the street were to research the topic that we're discussing today, if they did just a cursory glance at the historical literature, and they really honestly weren't digging deep to try to find out what is the history between suicide, assisted suicide, euthanasia, and Christianity, here's what they're going to come up with. Number one, not only does the Old Testament nowhere condemn suicide, but it also records several suicides without any hint of disapproval.
Brad, are you in your books?
I am actually in a book called A Different Death.
Oh, okay.
And I'll try to copy these and post these up for you guys. Number 2, the New Testament nowhere forbids suicide. The one suicide that it relates, that is of Judas, is presented as a mark of his repentance rather than any further sin. Even Jesus' death was, in a sense, a suicide. There's also a real possibility that the Apostle Paul committed suicide.
What?
Hold on.
Somebody's distracted.
Number 3. So eager were many early Christians to realize their fullness of joy in heaven that they committed suicide if they were unable to provoke pagans to put them to death as martyrs. Number 4. So depressing was the burden of sin and guilt of many Christians that they killed themselves in despair. Number 5. So intensely did many early Christians despise their sinful flesh that they killed themselves, often through severe acts. Number 6, so low a regard did early Christians have for their lives that they were willing to die for their faith, some even volunteering for provoking martyrdom. And martyrdom, according to what this person studied, they would say is suicide. And last but not least, this person says Augustine was the first Christian to denounce suicide as a sin. His negative influence has subsequently tempered the Christian attitude to suicide, including both active and passive euthanasia.
That's dumb.
All right. How would you, now again guys, this is somebody who did a very casual glance at a well-known university library and typed in keywords like history, suicide, Christian, or euthanasia, early church, Christian, and they came up with these 7 points. How would you respond to that if, say, one of your teens in your church comes to you and says, look, I don't think there's anything wrong with it?
Well, the first thing I would say is based on both what we know from Scripture as well as what secular history about the early Christians tells us, it's pretty improbable that if a Christian really wanted to die, that he'd have to look very hard to find somebody who would kill him.
You mean the Romans?
Right, or the Jews, or...
Okay.
Hey, Brad,
Yes, sir.
in Acts 16, you have the Philippian jailer who, upon the earthquake and the doors were open, he's about to kill himself. And Paul
Yes.
says, no, wait, we're all here. So he's
Okay.
about to commit suicide. And Paul
Okay.
says, no, don't do that. Because we're all here. There's no reason for you to take your own life. And I guess throughout other scriptures like Job, where Job talks about taking his own life, he doesn't do it. I mean, if you just look at the...
But Dean, and I'm playing devil's advocate here, but Dean, could you honestly say the jailer, that situation was them stopping him from suicide, or was that them informing him that nobody had left, that he was okay?
Couldn't it be both? By stopping him, by saying, hey, we're all here, they stopped him from taking his own life.
Okay. James.
2 things. I think if the early Christians wanted to die, maybe they could, but they wouldn't want to endure the torture that they had to go through before they died. I don't think they would have thought that was worth it. They could have conveniently killed themselves another way. And also, Jesus said what the second greatest commandment was, and that was to love your neighbor as yourself. And if we're not supposed to kill our neighbor, we shouldn't be killing ourselves. There's a
Okay.
sense of self-worth.
I can sort of kind of by that, but what somebody may argue is, well, if my neighbor had pancreatic or liver cancer and was hurting as bad as I am, then they might want me to kill him, or at least ease their pain and suffering.
Jesus didn't put those qualifiers on that verse, though.
He might have in one of the new amplified versions.
No doubt that.
Quentin, in the back.
In Colossians chapter 2, Paul says he's suffering. He says, for I want to know how great of a sufferer I have on my behalf. Then he drops
Absolutely.
down. The whole section's talking about how you're built up in Christ. So he's suffering. Then he says, I want you to have the full assurance of the mysteries and the knowledge of wisdom. And then you jump to verse 18. He says, let no one keep defrauding you of your prize by delighting in self-abasement and any worship. So there's no point in, hurting yourself.
Asceticism is forbidden in the New Testament.
Right. And Brad?
This is biblical.
Yes.
How do you feel about, can I ask him how he feels about that, Chris?
Yeah.
I don't want to jump. I want to know how.
No.
Let's look at what we've got from Scripture first, guys. We got 4 suicides in the Old Testament. We've got 1 in the New Testament. Okay, these are cases that I feel like we could probably pretty easily call suicide. We got Samson, we've got Saul, we've got Abimelech. I'm gonna let y'all pronounce the last one, and we got Judas Iscariot. Let's start with Abimelech. We'll kind of go more in alphabetical order. Somebody tell me what happened.
The girl threw a
stone and crushed his head, and instead of being known for a woman killing him, he has one of his own men stab him.
Okay. Judges chapter 9. For those of you guys who want to kind of keep a note somewhere about what we're discussing. Dustin pronounced it pretty dead on, spot on. You got a lady, a millstone falls from up above, it hits his head. He realizes, oh man, I just got killed by a woman. This is going to really look bad on me. I don't want him to go down in history as being killed by a woman. So he says to his armor bearer, draw your sword, kill me, lest it be said of me that a woman slew me. So, somebody tell me what was the end of it all? What happened to Abimelech?
Well, he was still obviously known for being killed by a woman because the Bible says it.
Good point.
So he couldn't escape that.
He's killed by his stone.
I don't know. If a woman almost killed him yet.
Did his armor bearer kill him?
Yep.
Pierced him through and he died. Judges chapter 9 verses 52 through 54.
So not only
If you look in verse 56 of Judges 9, notice what it says. Thus God repaid the wickedness of Abimelech, which he had done to his father in killing his 70 brothers. So, basically, although the scripture is never approving or disproving of this act of assisted suicide, it's, to me it's kind of fitting that you got an evil guy who finds his death in this particular way. Abimelech's our first one. Samson's the next guy. Samson, if you look in Judges chapter 16, somebody give me a decent summary of how he died.
He wanted to get rid of the Philistines, and so he prayed that God would return his strength to him momentarily so that he could pull down the pillars of the Philistine temple, and he did so, and he died along with the Philistines.
Okay. Keep going.
He died?
He even said, let me die with the Philistines.
Right.
All right, so guys, like it or not, this is a dead-up case of suicide. You may not like me saying that, but Samson is premeditating his death. Now, when you think about it, you got a guy who used to have all this strength, and basically they have mutilated him. He finally gets to stand between the pillars. He pushes the pillars down. Boom, everything falls. Everything's good. How do we look at that today?
Brad.
Yes.
I guess I would I would disagree with you with regards to him premeditating suicide regarding Samson.
Why do you say that?
Because how would this instance of him saying, hey, I'm going to die with the Philistines be any different than someone who is in a combat situation who they're pinned down or whatnot, and they say, hey, this is it, I'm going to die with the enemy.
Hey, listen for just a second, Dean. Here's his prayer. He says, "Oh Lord God, please remember me. Please strengthen me just this time, O God, that I may at once be avenged of the Philistines for my 2 eyes." He grasped the 2 middle pillars on which the house rested. He braced himself against them, one on his right hand, the other on his left. You don't think that there's some premeditation right there?
I would say that he understands that this is going to be it.
Okay.
But I wouldn't say that if I was pinned down in the streets of Fallujah and I knew that the odds were against me, that would be me premeditating my suicide.
Okay, but Dean, you're missing a major difference. How would you die in Afghanistan?
Well, there are plenty of ways to die in Afghanistan, but
in the scenario you just gave, it would be at the hand of an enemy.
If we were on whatever, MSR Mobile or whatnot
Okay.
was over there. And we came under attack.
Mm-hmm.
And we were absolutely positively pinned down. And, for instance, let's say we were like
Dean.
Samson and we were mortally wounded.
Dean, you keep using words that you either aren't hearing or aren't thinking about. You're using words like being under attack or being combat, people shooting at you. There's a light years difference in somebody else ending your life in a desperate situation
Okay.
versus you telling your sergeant, hey, I'm going to go lay in front of this Humvee and I'm going to take this stick and hit the accelerator. Is that cool with you? Two different situations.
Okay.
Because you got Samson who is saying, Lord, give me some strength because I'm bringing the house down. And
Okay.
he's pushing the pillars to where they're going to fall on his head. Versus you being under fire out in the field somewhere in a really bad situation that you look around and you say, I'm not getting out of this.
All right. Okay, I see what you're saying. How about then a hostage situation? For instance, those
How about
guys that are on Al Jazeera.
Yeah?
If someone was under a hostage situation and they were in a room by themselves
Yep.
and they said, hey, I'm going to bust out of here. And they bust out of there and they say, I'm taking as many, I might not be able to get out, but I'm going to take as many with them as I can. Would that be the same thing? Would that be premeditated suicide?
Now, I guess what would be premeditated suicide is if somebody in a lockup confinement looks around and says, I'm going to try to blow up this building and take out as many of these guys as I can.
Okay.
So I'm gonna eat this grenade that they don't know I've got.
Okay.
And you pull the pin, you fold over, and you invite them to come around you, and gabooey. There you go.
Okay.
James.
Regarding Samson, I had 2 points. He prayed to God to give him the strength, and God gave him the strength.
Yep.
And then in Hebrews 11, the Hebrew writer says, and what more shall I say? For time will fail me if I tell of Gideon, Barak, Samson, and then a couple list of others. And then it says, who by faith conquered kingdoms, performed acts of righteousness, etc., etc. Speaking of Samson in a very positive light, that's Hebrews 11:32.
Yep.
So I mean, I don't know.
Let me read you guys. Let me read you guys what Josephus said about him. Such was his end after governing Israel for 20 years, and it is but right to admire the man for his valor, his strength, the grandeur of his end, as also for the wrath which he cherished to the last against his enemies. That he let himself be ensnared by a woman must be imputed to human nature, which succumbs to sin, but testimony is due to him for his surpassing excellence in all the rest. That's what Josephus basically had to say about it. Somebody tell me what happened to Saul. And if you don't know that there's two accounts,
In the first Samuel.
yeah, somebody go ahead and read to me 1 Samuel chapter 31 verses 1 through 6. And while they're doing that, somebody be looking at 1 Chronicles chapter 10.
So I'm still a little confused on Samson, Brad.
Yes.
Are we saying that, not we, but are you still under the idea that it was premeditated suicide?
Did he ask God for strength?
Yes.
Did he put his hands on the poles?
Obviously, yeah. And he brought it down.
Okay. Would you not think that that's the equivalent of somebody basically picking up a gun?
I would say, yeah.
Okay. There you go. For it not to be premeditated, Dean, what it would have to mean is he walked out of the main hall, stumbled into one of those pillars, and everything came crashing down.
I disagree with what you just said, I must have to say.
That's
About
fine.
picking up a gun.
Okay. Why?
When somebody picks up a gun to kill themselves, they have mental issues down in their heart that are causing them to do something like that.
Okay.
And that's where I think the wronging is in suicide.
That's what says a negative act.
Right. Where yeah, like Quinn said, a negative act. Where Samson was going out to do the glory of God, to do what he was supposed to do. Likewise, if that person in a hostage situation covered that grenade, he was doing that for the betterment of everybody else, being as unselfish as he can be. And I
Okay,
think
Dustin, let me ask you one question. Has God ever given man the right to take life?
Has he ever given man the right to take a life?
Right.
I can't answer yes or no. I don't know enough about why.
Yeah, absolutely, yes.
In what situation?
He told Saul, yeah, in real time. In fact, Saul
Okay,
got in a
more-
lot of
I-
trouble because he didn't
I
spare life.
agree it's your wartime. I'm talking about just in everyday life. Do we have the authority to take life?
Oh, well, are you talking? So you're saying you're not saying taking a life. You're talking about murder, which is a different thing. We don't have.
I'm talking taking life that God has given.
Innocent life.
Life.
Yeah.
In the Old Testament, there was the blood avenger. If you killed somebody, then if you didn't get to one of those 6 cities, right, then your life could be taken.
Absolutely.
And I mean, you have to know that there's someone coming after your life if you kill somebody.
Right, and likewise in all of the Old Testament laws, when you look throughout the Pentateuch, every time somebody dies, what is the price for it?
Yeah.
Another life. So, Chris and Dustin, the point I'm trying to make is God has never arbitrarily said, well, you know what? I think in this situation, I'm just going to allow you to, if you feel like your secretary didn't bring you coffee that was good enough to drink, you can just take her out.
Right. Okay, but the Philistines weren't exactly
The secretary,
bringing
yeah.
coffee. And it's not
Right,
like some
no.
the Philistines were innocent of they were guilty of innocent blood.
Believe it or not, that's why I think in this case, I think we actually have a fairly decent exception clause, because God did instruct them to go into the land of milk and honey and kill everybody.
Right.
And the reason they messed up was because they didn't kill everybody.
Right.
And some of their influence then seeped in, and we're still living with that today. But outside of that, when he's talking to the Israelites and he's talking about, hey, in your normal walks of life, if you kill somebody, here's what's going to happen. We can't just assume that it's okay to ever do that. Dean. Dude, y'all gotta pick up the pace, because we got like 107 more slides to go.
That's all right, but
I don't agree.
you're still. I still think you're in kind of a bind because of what James brought up in Hebrews 11. Because if that's the case, and it speaks of Samson as doing the righteousness of God, then you've got God being okay with premeditated suicide, and that just doesn't add up. If we're going to say that suicide's bad.
Or, Dean, is it acceptable in this instance because it is cleaning up the Philistines?
I think it's because it's the
Well, wait a
Philistines.
minute.
Because he
Absolutely.
also mentions Rahab.
Yeah,
Yeah.
that's exactly what I was going to say is Rahab. And Rahab is still wrong.
Yeah.
But also, who's to say that he's talking about Samson doing the glory of God in this situation? Could it have been in some other situation that Samson did the glory of God? In Hebrews 11.
That's true. Very true.
But if it's
Very
speaking so positively, chances are he's going to be on the right side of eternity.
Amen.
And
Right.
if he committed suicide and that was wrong, then I don't think that would be the case.
It's Canaan.
All right, let me throw one thing out to you guys just to go ahead and land this plane. We'll talk more about it next on Thursday, but I don't think all cases of suicide actually are going to send you to hell. And the reason I say that is we talked last time about mental illness.
Okay.
If somebody is mentally ill and they are not in their right mind and they honestly are not thinking correctly and their brain is misfiring so bad that they take an overdose of pills or they do whatever, are we ready to say that that person is hell-bound even though they're not in their right mind?
No.
Okay.
So Samson
What
mentally.
we're dealing with today, the two things that we're dealing with today are suicide or physician-assisted suicide and euthanasia. We're trying to get a look at what the Bible says. We're trying to then paint it into what we've got going on today. We got to keep moving. What about Saul? Somebody read me 1 Samuel 31, verses 1 through 6.
Now the Philistines were fighting against Israel, and the men of Israel fled. Someone else is about to read this. I'm about to lose one.
Now the Philistines were fighting against Israel, and the men of Israel fled from before the Philistines and fell slain on Mount Gilboa. The Philistines overtook Saul and his sons, and the Philistines killed Jonathan and Abinadab, and Malchishua, the sons of Saul. The battle went heavily against Saul, and the archers hit him, and he was badly wounded by the archers. Then Saul said to his armor-bearer, "Draw your sword and pierce me through with it. Otherwise these uncircumcised will come and pierce me through and will make sport of me." But his armor-bearer would not, for he was greatly afraid. So Saul took his sword and fell on it.
Okay. So that is the account in 1 Samuel. What about 1 Chronicles, chapter 10?
10. Where do you want me to start? Chapter 1 or verse 1?
1 through 6.
Now the Philistines fought against Israel, and the men of Israel fled before the Philistines, and fell slain on Mount Gilboa. And the Philistines overtook Saul and his sons, and the Philistines struck down Jonathan and Abinadab, and Malchishua, or the sons of Saul. The battle pressed hard against Saul, and the archers found him, and he was wounded by the archers. Then Saul said to the armor-bearer, "Draw your sword and thrust me through with it, lest these uncircumcised come and mistreat me." But his armor-bearer would not, for he feared greatly. Therefore Saul took his own sword and fell upon it. And when his armor-bearer saw that Saul was dead, he also fell upon his sword and died. Thus Saul died, he and his 3 sons, and all his house died together.
Okay. Somebody tell me what happened to, if we look at where you got the Amalekite coming and reporting this, what happens to the Amalekite?
Isn't he told that he's a liar?
Do what? Oh, come on, guys.
What was the question?
What happened to the Amalekite that reported this? You guys know. Hold on, let me look at 2 Samuel chapter 1, verses 4 through 10. Somebody read that. You guys should know this, by the way. 2 Samuel chapter 1, verses 4 through 10.
David said to him, "How did things go? Please tell me." And he said, "The people have fled from the battle, and also many of the people have fallen and are dead, and Saul and Jonathan his son are dead also." So David said to the young man who told him, "How do you know that Saul and his son Jonathan are dead?" The young man who told him said, "By chance I happened to be on Mount Gilboa, and behold, Saul was leaning on his spear, and behold, the chariots and the horsemen pursued him closely. When he looked behind him, he saw me and called to me, and I said, 'Here I am.' He said to me, 'Who are you?' And I answered him, 'I am an Amalekite.' And he said to me, 'Please stand beside me and kill me, for agony has seized me, because my life still lingers in me.' So I stood beside him and killed him, because I knew that he could not live after he had fallen. And I took the crown which was on his head and the bracelet which was on his arm, and I have brought them here to my Lord." And David took hold of his clothes and tore them, and so also did all the men who were with him. They mourned and wept and fasted until evening for Saul and his son Jonathan, and for the people of the Lord and the house of Israel, because they had fallen by the sword. David said to the young man who told him, Where are you? And he answered, I am the son of an alien, an Amalekite. And David said to him, how is it you are not afraid to stretch out your hand to destroy the Lord's anointed?
There we go. You stop right there. Now somebody tell me what happened to this dude.
He got cut down.
He got waxed.
He got killed. Now, let me point out, we don't know, and we won't know until we reach eternity, which one of these two scenarios actually took place. We don't know if Saul did it himself, and this guy was basically trying to take the glory for it, basically saying, look what I did, or if he really did have to help. You know, a lot of the scholars say that both of them happened, that Saul was trying to kill himself, that he had lost his strength, and he sees this guy, he sees these people coming, he basically says, look, give me a push, and he thrusts him on his sword. Dude basically goes back and says, look, I helped him, he was suffering. The point being, what did he receive for taking his life?
Yeah.
He received death. Somebody tell me what happened to Judas Iscariot.
Hung himself.
Fell headlong.
He hung himself.
Betrayed Jesus.
Do what?
I said hung himself, and Chuck was like, he fell headlong.
Exactly. Both of you are right. Very good. Acts chapter 1, verse 18. Let's go to Arthur Drove,
Did Paul
who says, what if Paul believed that his missionary work was finished? That the divine necessity that had been placed upon him had been finally removed? What if he became convinced that he had fought the good fight, finished the race, and that the time of his departure had come?
So out of context.
Yeah, what if? Yeah, so what?
And
Are we able to say that Paul... How did Paul die?
Well, we don't know definitively because Scripture doesn't tell us, but tradition, history tells us that he got
his nugget lopped off.
Yeah, he got his nugget lopped off.
Okay, so he was beheaded. So could we say that that was a form of suicide?
Nope.
No, that was execution.
Okay, what about this one?
No.
Wow.
That's not suicide.
Yeah.
Yeah.
Sacrifice.
You've already-
Self-sacrifice versus suicide, two different things.
Well, he knew when his time had come. So.
Okay.
Jesus isn't dead, by the way.
Do what now?
I said Jesus isn't dead.
I would agree with you there. Did he experience death?
Yes, he did.
Then he overcame.
Yes, he did. All right. Let's figure out where we're supposed to be in all this. Plato suggested that if life itself became immoderate, then suicide became rational, a justifiable act. Plato said the painful disease or intolerable constraint were sufficient reasons to depart. Within 100 years of Socrates' death, the Stoics had made suicide the most reasonable and desirable ways out. So, all right, I say all of that, guys, all of this background stuff to say this. There's a lot of question and confusion about the past. And when a skeptic looks at it, he says, maybe the Christians were killing themselves on purpose. Maybe Jesus was a case of voluntary death where, it's kind of like a suicide. Everything kind of changes with this guy, with a fellow by the name of Augustine, who says, look, bottom line is suicide in any form is a sin, is wrong. And it's from his time forward that basically people who identify with the Christian religion have viewed forms of suicide differently maybe than we did in the past. Now, let's fast forward to the year about 2008, 2009. You've got a California judge. Of course. Of the beautiful Ninth Circuit Court, who is trying to rule on physician-assisted suicide. Okay? I want us to look at 5 of his assertions where he is trying to use this history that we just talked about as the basis for his ruling. First thing, Reinhardt asserts that because the church promoted such a bleak view of life and such glorious views of heaven, suicide, he says, became an increasingly strong temptation for early Christians. Okay? We ask, all right, where's your evidence for that? Because, guys, there is no evidence of any early Christian during the early centuries of Christianity committing suicide in order to accelerate getting to heaven. You know, it's one thing to say, I'm going to die for Christ, but it's another to say, dude, I'm going to speed it up and be on the quick train, you know? I'm just going to go on and check out right now. Second thing that Reinhardt said was that he described the type of suicide in question as martyrdom. But again, we got to ask the question, you know, martyrdom was a special situation involving state persecution of Christianity prior to the Christian religion being legalized. It was not indicative of a general desire for death, but more of an imitation of Christ's death. Two totally different things. So if somebody is trying to say, hey, you know, realistically, y'all you Christians, y'all really support suicide, you just don't know it. Well, let's go back and look at what is the truth. The truth is martyrdom was when people were being persecuted by the state before the religion was even legalized. And it wasn't that these people were seeking death. They were simply seeking to be able to worship. And when they couldn't, they found Christ's death a good imitation, a good alternative. Number 3. Reinhardt suggests that martyrdoms, which were predominantly of the Donatists, a splinter group, so threatened to deplete the ranks of Christendom that Augustine condemned suicide in general as a damnable sin. In other words, basically their numbers were dwindling so bad that they said, we got to stop the bleeding. We got to say that this is wrong, or else Christianity is going to fade away into non-existence. But again, if we were to put this fruitcake judge on the stand and say, where's your evidence? Because, folks, if they were really worried about numbers, why did they wait so long? Because the time of Augustine, the church was actually flourishing. It was prior to that the church was so small that every time somebody died, it was a bigger impact. Does that make sense?
Yep.
I mean, if you're going to outlaw it strictly because of numbers, you would have outlawed it much, much earlier. Let's see. This should be last. Last, Reinhardt adds that before Augustine's time, there was considerable confusion between suicide and martyrdom within the Christian community. And when I ask the question, where's his evidence, basically, my question would be, has that confusion really been resolved? So let's look at this topic today, now that we are basically an hour into class and we're just through our introduction. Let's look at the topic of physician-assisted suicide, of euthanasia. We're going to start with this little document right here. Hippocratic Oath. Listen very carefully to what the beginning of this thing says. I will follow that system of regimen which, according to my ability and judgment, I consider for the benefit of my patients. I will abstain from whatever is deleterious, mischievous. I will give no deadly medicine to anyone if asked, nor suggest any such counsel. And in like manner, I will not give a woman a pessary to produce abortion. Now, that was the Hippocratic Oath, or is the Hippocratic Oath. I don't think any of us would really find it surprising to find out that only 8% of doctors pledge to forswear abortion, and only 14% promise not to aid patients in acts of euthanasia. So out of all the physicians that are coming up through medical school today, you've only got 14% that say, you know what, I'm not going to put grandma out early. Or I will not, under any circumstance, put grandma out early. Somebody tell me, what is the Greek for the word euthanasia? What does it mean?
Good thanatos. Good death.
Good death. It is basically translated as well or good death. American Medical Association defines it as the administration of a lethal agent by another person to a patient for the purpose of relieving the patient's intolerable and incurable suffering. And yet, according to their own code of ethics, guys, physicians are to respond aggressively to the needs of patients at the end of life, but they cannot engage in euthanasia. So the AMA recognizes that this is a real situation, but they say that doctors are not supposed to do it. Now, what do you call a good death? What is good death? James, what would you say is a good death?
Living I don't know. I mean, dying naturally after living a great life serving God.
Okay. What else? Well, how do you see how the very concept of defining good death can mean so many things? To some people, they want it over quick. Some people want to die in their sleep. Some people want their family around. Other people don't want anybody around. So how do we go about qualifying what really is, quote, good death? Now, most people would use the adjectives that it would be peaceful, that it would be painless, that you would have some form of lucidity. A lot of people would like to have their loved ones gathered around, but then again, some folks aren't really excited about having their bowels release with all their loved ones around. That's not exactly the most warming thought, to have your colon empty itself and your bladder empty itself after you take your last breath, right while all your family's hugged up against you. The question is, okay, are we allowed to manipulate things as humans in order to try to strive for a good death? What are the 5 stages of death? Anybody know?
I don't know.
Have you guys not had like a class on like death and dying, funerals, that kind of thing?
Nope. No.
Oh, you're kidding me.
Not as a preacher.
Are you serious?
We're doing stuff on funerals and stuff, but we haven't gotten to preacher in his work.
Okay, all right.
Sorry to disappoint, Brad.
Dude, we gotta brush y'all up quick. I need to get y'all into a funeral home. First stage is shock and denial. Now, again, this is for both the person who is dying and or somebody who finds out. Let's say that you find out your spouse is dead or that your child just died. First thing you go through is shock and denial. It can't be. Then you get mad. You get angry that this has happened to you. This is a personal thing. Then a lot of people try to bargain with God. Hey, God, you know, if you will fix this, then I will do X, Y, Z. If you take away this cancer, then I'll be there every time the doors are open. Then stage 4 is normally depression, and that's the stage that can vary in length from just a few days to months and months and months, depending on how the person responds. A lot of times, if it's a Christian who realizes, hey, I'm going home, then depression is not that long. The last stage, obviously, then is acceptance. You realize, you know what? I'm going to die. I'm ready to die. Let's get this thing over with. Those are the 5 stages that folks will go through, both the survivors and those who are just find out that they are going to be dying. When we look at definitions, let me back up and show you this one. Suicide is defined as the act or instance of intentionally killing oneself. Now, ironically, guys, when I talk about Samson, we talk about premeditated suicide. Could somebody make the argument that he was not intentionally killing himself, but rather he was trying to kill others?
No.
and that he was just a casualty of that.
He was, well, that gets into what his intent was. He knew he was going to die, but
Yeah,
He said, "Let me die with the Philistines." That pretty
That's
much
right.
takes care of that.
well,
exactly.
that's because he was
Physician-
wearing.
Physician-assisted suicide would then add that a doctor provides the means by which a patient commits suicide. Okay, so let's make sure we're good on these two. Suicide is defined as the act or the instance of intentionally killing oneself. Physician-assisted suicide would then be where the doctor provides a component, usually a drug or a machine, that will help bring about death. Now, why in the world are we even talking about this? Why is this an ethical dilemma to begin with? Primarily because you've got more and more people who are dying in medical facilities. You got 85% of Americans who are now dying in hospitals, nursing homes, or hospice environments. Of that group of 85% of Americans, 70% choose to withhold some kind of life-sustaining treatment. In other words, 70% make the conscious choice that I'm ready to go. I want to end this thing. Don't give me any more blood transfusions. Don't give me an antibiotic. Don't give me X. Just let me go. From a historical perspective, it used to look like this. Up until the 1940s, medical care was often just comfort care. Basically, you were alleviating pain whenever possible, and yet the last 50 to 60 years, medicine has become increasingly capable of postponing death. So now we got a situation where we put somebody in the hospital where earlier they would die. We knew they were going to die, so we'd give them some pain pills, and boom, they'd be dead. Today, we can actually postpone that death. So now we're forced with these choices of, do we allow ourselves to die, or do we postpone death through extraordinary means? Another factor that you guys need to be very aware of that is real, especially given the current debate going on right now, is insurance. Initially, the difficulty was that physicians often wanted to do more to save the dying than either the dying person or their families wanted to. Now the difficulty is that insurance companies and managed care may provide financial incentives for doing less. Close to a third of all Medicare dollars are spent on end-of-life care. In other words, in the past, let me get rid of the screen so I can actually see you guys. In the past, guys, it was a common practice for physicians to take a very proud role of their life expectancy rate or their mortality rate. They wanted to be known as, hey, that's the guy that can keep you alive. If you get sick, you need to go to Dr. So-and-so. Because these are the doctors that would do anything and everything in their power to keep grandma going a few more days or months or weeks. Well, all of a sudden, insurance companies realized that those last few weeks, that, yeah, you might keep grandma alive for 2 or 3 weeks, but it was costing hundreds of thousands of dollars. And insurance companies said, hey, doc, brother, we will put you on a Caribbean cruise if you slow down the aggressiveness of what you're doing and allow some of your patients to just go on and meet their maker. Now, they didn't say it that way. They basically said, hey, we'll reward you if you use this drug instead of this drug. Or we'll give you a kickback if you take this procedure instead of this procedure. Or we'll pay you more money, a higher percentage on your return, if you follow this course of treatment versus this course of treatment. And so it became financially and other advantages to a physician to start thinking about, okay, do I really want to keep grandma alive? Or do I want to follow a path where I'm going to get the most payback from this particular care? Thoughts, questions so far? Cut.
As far as suicide goes, we said that it's someone taking their own life.
Okay.
So if let's say I asked Dustin to shoot me in the head so that I could die, that wouldn't necessarily be suicide as much as it would be murder, because he would have free will and free moral choice.
Yes. And because he would actually be the person who was bringing about your death.
Okay.
Which is why what we're going to talk about next on Thursday is going to be so emotional, and some of you are either going to like it or not like it when we talk about things like pulling the plug, pulling feeding tubes, things like that. But again, you painted it beautifully in that if you do it, it's one thing. If somebody else does it, it's something else. James.
I was just going to say, we were talking about suicide, and in the last part, we were talking about withholding life-prolonging treatments. Are we going to make the distinction over this week that there's a difference between... Okay, I just wanted to make sure. I didn't know
Absolutely.
being synonymous.
Absolutely.
Okay.
Yep. In fact, we're getting there very quickly. Let's look at some initial distinctions between these two. First, you've got active versus passive euthanasia. You've got voluntary, non-voluntary, and involuntary euthanasia. Then you've got assisted versus unassisted euthanasia. I know when you guys probably saw the syllabus and you look and you say, okay, Brad's talking about euthanasia today. It's probably going to be, one and done, quick, easy class. He's going to tell us euthanasia is wrong and we're going to be done. Well, it's a whole lot more to it than that. And I want you guys to be aware of all the different little distinctions, because the reality of it is, most of you, if you haven't already been in a situation where you've helped somebody through terminal decisions, you will probably. So let's at least look at some of these.
Slide, Brad.
No, I'm sorry, I can't. Just kidding. You got active versus passive. You got voluntary, non-voluntary, involuntary, assisted versus unassisted. Let's look at each one for just a minute.
Thanks, Brad.
Active versus passive. Active euthanasia occurs in those instances in which somebody takes an active means, such as a lethal injection, to bring about somebody's death. Passive occurs in those instances in which someone simply refuses to intervene in order to prevent somebody's death. All right, so let's look at a little, criticisms of these two. So you got, for instance, conceptual clarity on the first one. You've got vague dividing line between active and passive depending on the notion of normal care. Because let's say that somebody is dying. Is normal care giving that person water or food?
Normal care?
Yeah.
I'd say so. Yeah.
If that person has a blocked colon, would that be considered normal care?
I don't know.
There we go.
You're right.
That's why we're having this class. The other is moral significance. Does passive euthanasia sometimes cause more suffering? In other words, if you don't do anything, is that person going to suffer more and therefore you've got a bigger problem on your hands? Active euthanasia is this. You got a typical case where there's no doubt that the patient's going to die soon. The option of passive euthanasia causes significantly more pain for the patient than active euthanasia, and it does nothing to enhance the remainder of the life. Passive measures will not bring about the death of the patient. Therefore, the person chooses what they would call active euthanasia. Now again, just to kind of review the three cases, you got a voluntary where the person is assisted to die in their best interest after competent request. Non-voluntary where a person is assisted to die in their best interest but without being able to make a request. But you also have involuntary where a person is assisted to die supposedly in their best interests but against their expressed wishes. What do we call number 3?
Murder.
Murder! And believe it or not, it does happen. Let's look at assisted versus unassisted. Many patients who want to die are unable to do so without assistance. Some who are able to assist themselves commit suicide with guns or etc., ways that are much harder and difficult for those who are left behind. So, if we were to look at an overview of this whole thing, and this is kind of what I want you guys to remember right here. Here are the classifications. You've got a passive approach, where, for instance, it's currently legal, often contained in living wills. You got an active, where they're not assisted, which is equivalent to suicide for the patient. You got active, which is also could be assisted. And I tell you what we're going to do. I'm going to actually leave this up on the screen while you guys are at break. We'll kind of review it quickly when we come back.
Can you go back one slide?
Can I go back a slide?
Yeah.
I'll go back a slide for a minute or two, and then I'll leave it on this one while you guys are at break.
Okay.
You're gonna post this stuff, aren't you, Brad?
Of course.
Okay.